Hello, I'm Dr. Croley and welcome to Case of the Day. Today we're going to discuss an interesting case about a syndrome called pseudoexfoliation. So a patient come in today, an elderly lady who was complaining of vision problems and had cataracts, and once we dilated her eye, we noticed that she had these little flake-like deposits on her lens, the anterior surface of her lens, which is called pseudoexfoliation. It was first described by a Finnish ophthalmologist many years ago, in which he described these flake-like deposits that turns out to be a protein or amyloid-like substance that deposits onto the surface of the lens capsule. So we see these little flakes around the front surface of the lens, and the reason it's called pseudoexfoliation, it looks like this lens capsule is exfoliating or peeling off, but in actuality it's deposits of protein on the capsule. There is a syndrome of true exfoliation that was found in glass blowers from infrared heat. It actually was causing the lens capsules to peel, and that is a true exfoliation, but this syndrome is pseudoexfoliation. It is more common in women. It is found maybe more commonly in Scandinavian people, so there may be some genetic component to it, but we still don't know the answer to that yet. A little higher incidence in different populations in Europe. And so what does this do other than we're noticing these little flecks? Sometimes the little flecks are also located in the zonules that hold the lens in place. And it tends to in these people that their lens capsule and these zonules that hold the lens in place are weakened by whatever this deposit that's going on. And so for cataract surgery, there's a slightly higher complication rate of cataract surgery as we remove this lens because of the weakening of the capsule and the zonules. The other thing that's typically associated with pseudoexfoliation is that this protein material can also be found in the meshwork, trabecular meshwork, out to the side where the fluid drains out of the eye, and also around the edge of the pupil, so people don't dilate as well because this protein constricts the dilation, and as it blocks this canal, people typically have glaucoma associated with pseudoexfoliation. And it typically also is just usually unilateral, that is, it's in one eye, not both, and it doesn't usually occur until later in life after age 70 or so. And so if someone gets glaucoma from this, then we have to treat the glaucoma like we would any other type of glaucoma, either with laser treatments, medications, and in severe cases, actually surgery for glaucoma. But the real thing typically is these people, when we see people like this, they have cataracts and have pseudoexfoliation along with the cataract. And like I said, it does increase the risk slightly by having this syndrome. So that's the pertinent things about pseudoexfoliation. It's probably an incidence of maybe 2 to 3% of people, depending on the distribution or population that we're just talking about. Like in the European population, could be as high as 5 or 6%, especially in Scandinavian people, that people have pseudoexfoliation. Even though I'm saying there's a little higher complication rate, still people typically do very well with this. So it isn't that because you have this that there's going to definitely be a problem, but there is an increased risk. So if you have any questions about pseudoexfoliation or any other kind of eye problem, we'll be happy to try to go over that, give you an answer. If not, may God bless you with healthy eyes and great vision.